and on LinkedIn. Hi, hello everyone. I hope you can see us and hear us well. So today we're talking to the audiologist, Dr. Keith Darrow. A very impressive resume. I looked at the educational background. So you are from Harvard Medical School. That's extremely impressive. Also, the professional experience, absolutely outstanding. And I know you founder of the company, which mission is actually dedicated to really helping people improve their situation with the hearing loss, etc. Anyhow, hearing loss, before understanding the situation, I had no idea how important it is for multiple areas of our life. And the statistics tells us that only 1 of 5 people ever would even complain and ask a doctor for the help, because for the most cases, people have no idea that they have issue with the hearing issue, basically. Anyhow, Dr. Keith, thank you so much for being with us today.
Well, thank you for having me on here and for helping me to spread this really important word about hearing loss, because if we're being completely open and honest with each other, hearing loss is a fact of life. It's one of those things that as you get older, it's going to happen. There's no way around it. Is it different in everyone? Is the stage and the extent of the damage different in everyone? Yes, but it is a fact of life. And I appreciate what you said, which is, even you, highly educated, I run into doctors all the time, medical doctors, PhD, and they say, I didn't realize how important healthy hearing was for social, emotional, physical, and cognitive health.
Exactly. Yes. So let's discuss, because we have very broad audience. We have people from all around the world, and they will see us and watch us one way or another. So the question is, first of all, we know that hearing loss is absolutely unavoidable. We are literally losing with time, simply with time, because our ear is so sensitive in multiple ways, on multiple levels, and there is basically hearing loss strongly associated with aging, right?
Oh yes, aging is the number one cause, and here's the simple way to think about it: you will get hearing loss as you get older. Mm-hmm. If you're exposed to loud noise, the aging process will start earlier. If you are exposed to certain medications, be it strong antibiotics or chemotherapy or even over-the-counter pain meds, it will start the age-related hearing loss earlier. So these things compound, and then throw on some of the most common disorders of diabetes, cardiovascular disease. These all exacerbate that underlying hearing loss, right? We know from enough experiments that even people who live in perfectly quiet communities, live a very healthy lifestyle, they get hearing loss as they get older. But most of us don't live in a quiet place with a healthy lifestyle. And so we're finding hearing loss at a much younger age than we ever really thought was really possible. We used to think it was just in your 70s, in your 80s. No, we're finding out now that hearing loss, the neuropathy that leads to the hearing loss, really starts in about the 4th decade of life.
So I know that with the time, especially men, they're losing absolutely ability to hear high pitch notes. Basically they literally can't hear sometimes kids, they can't hear what women are saying, right? It was so from all possible perspectives, for the physical, from psychological perspective, that makes so much sense. That's a very interesting fact. Anyhow, let's return a little bit to the causes. You mentioned causes I never heard of before. So you mentioned that antibiotics like chemotherapy can actually result in a hearing loss. So let's briefly mention what are the main causes that compounds to the hearing loss. So you mentioned listening loud music, loud noises during at the workplace. Let's mention vibrations. I know that vibrations, especially high frequency vibrations, we're talking about transportation. We're talking about like elevation, like elevators in the buildings. We're talking about like literally living in some metropolitan areas, like listening they hear noise from the traffic. Like,
so you make a great point here, and I love this because here's the funny thing. I see patients day in and day out, and I ask every one of them if they've had noise exposure. And it's, you know, if I kept data, I promise you about 80 to 90% of people would say, no, I've had no noise exposure, because they think I'm talking about working in a factory. They think I'm asking them if they're a rock star who's been on stage for the last 30 years, right? Yes. But in truth, if you live in today's society,
just living,
just living, so really I've started to reframe the question of, have you been to a concert? Have you been to a wedding? Have you been to a noisy restaurant?
Are you driving a car? Are you driving a car? Because driving a car,
driving the car, mowing the lawn. Have you used a hammer? Right? There are so many things in this world that we think aren't a big deal. They're just part of our everyday life, but they are just causing damage after damage.
Have you ever taken the antibiotics? Do you have a history of taking antibiotics, like in the childhood, etc.? Here you go. We have hearing loss. So the reasons of the hearing loss, like there are multiple, and there is no way to even avoid it. Even if we will separate ourselves completely from the society, for environment, there is still a lot of ways to lose hearing. So
yes,
I know that there's, I read multiple of your articles. They're absolutely impressive. So let's talk a little bit about the stages. So we know that people have no idea they're losing, they can't hear, like literally.
Yeah.
They're getting, they realizing there's something wrong with them only on the later stages. And the thing is, the possible thing is basically prevent. So basically, if they would come to the doctor earlier, there would be high chance to prevent degradation, basically, right? With the time.
So you make a great point, and I want to state this so it's clear as day, because one of the most common questions I get is, should I get a hearing test? And if you're even asking me that question, chances are you're already struggling a little bit and you're thinking about your hearing. Yes. And then what the American Academy of Otolaryngology has said is 50 years old. 50 years old is the right time. So add it to your colonoscopy, breast cancer screening. That is when you should have your first comprehensive hearing evaluation. And if there's a problem, do something about it, right? Rather than just saying, I'm going to wait till it's really bad. That's like saying, I'm going to wait till my heart disease is really bad. I'm going to wait to treat my cancer until it's stage 3 or stage 4. Like, no, that doesn't make any sense. But if you think about hearing loss as it's not a big deal, then you wait. But if you understand that it's a neurologic disorder that significantly impacts not just your quality of life, but it impacts your brain, it can significantly increase your risk of cognitive decline and dementia, for which nobody wants to deal with, right? I mean, it's not like a guarantee, but there are so many studies now linking brain health to hearing health and physical health and emotional health.
But I know that there is a significant stages in the hearing loss. Let's talk about them, because people, I believe it will be interesting for people to hear it. So we have there is a main stages of the hearing loss, right? With the specific symptoms. Let's talk about the stage number 1, the light ones. What people usually experience.
Sure. And by the way, I just want to make this clear, because if there are people out there who've had their hearing test, they've heard what I lovingly call as these silly words like mild to moderate to severe, and they don't really have much meaning. And so you're right. We've done a lot of work in our clinics. Many clinics and associations have adopted the stages of hearing loss. And so I love this question and educating people. To your point, stage 1 is, if you want to think about it symptomatically, I always tell people, don't ask people if they have hearing loss or not, because everybody's going to say no. Just ask these simple questions. Are you having some difficulty hearing in background noise? So if you're at a restaurant and it's, there's a lot going on, do you struggle a little bit? And most people over the age of 50 will say yes. That is a sign of stage 1 hearing loss. Also, a little bit of ringing in the ears. So people will say, I don't really notice it, but when I lay down at night, I hear some ringing in my ears. Again, another sign
and
of stage 1.
That it's very correlated to vestibular system. So basically, they can have dizziness or like shaking.
That too, if you're starting to feel off balance, right? So there are many things that can sort of lump you into that stage 1 hearing loss. And then on the other side, right? So those would be the symptoms. Mm-hmm. You've got to have the right diagnostic protocol in order to properly diagnose stage 1 hearing loss, which is a very comprehensive, like, look, I'm just going to say this. If you've had a hearing test mm-hmm. and all they did was raise your hand when you hear the beep, I promise you missed out on 7 or 8 other tests that should have been done to really uncover the underlying disorder.
Okay, so I know that it's a complicated question, and I know that like our health system, like in the United States, it's a global issue. Basically, it's a global.
Yes.
It's not about the United States. So doctors are not equipped. They're not equipped with the enough knowledge, enough the instruments that would allow them to better understand what's going on and to find out the hearing loss of the early stages. So what is the best way currently? What do we have testing wise? Can we evaluate our hearing capabilities ourselves? What is the current situation with the testing?
So testing, look, there's subjective tests. Mm-hmm. Yes, raise your hand when you hear a beep. That's part of the test, right? Mm-hmm. Because what that helps us establish is the softest level that you can hear sound. But here's the thing. That's only important if you're moving forward with treatment. If you are working with your hearing healthcare provider, if you're going to invest in prescription hearing aid technology, then that test is important. But there's so much else we can do. Number one, we can actually, I'm not kidding, it takes about 30 seconds. Mm-hmm. We can send a sound into the ear and we can actually measure how the little hair cells, we can measure the integrity of the inner ear and see how it's operating. We then have some further testing that gives us a clue about the integrity of the neural system that connects the ear to the brain. Here's another one. About 99% of patients will say, I have difficulty hearing in background noise. We have a very comprehensive test that allows us to look at cognition, right? Because hearing is an ear thing. Listening, trying to weed out what you do versus don't want to hear, that's a brain thing. That's a processing thing. So you've got to go through that. In our network, right, across the Excellence in Audiology Network, which is a global network of hearing healthcare providers, we're all doing cognitive screenings too, because the last symptom that I didn't get to say before, the last symptom of even stage 1 hearing loss is some memory loss, is some concern about becoming forgetful.
Or communication, so you can understand what people are saying.
Yeah, exactly. It's so simple, right? If I can't hear you, if I can't hear you, I can't remember. It's that simple.
And the thing is, I found it out just recently. So we can hear a very specific range of the notes, and the thing is, basically the ability shrinks with the time. And the thing is, some people just live on a very specific range, and if you will talk them on they can't even hear it. That's so impressive. That's why.
Because here's the deal. See, with hearing loss, it's not black and white. It's not you can hear or you can't hear. It is a very slow, gradual process that I'm not kidding. It takes decades for that neuropathy to occur. And so what you have to look for, those early symptoms, like a little bit of ringing, some difficulty in background noise, maybe some balance issues, maybe sensitivity to loud sound. So if you go to a movie or you go to a concert and you're like, this is really loud, that's actually a sign of early stage hearing loss. And so people don't know these symptoms. So they're just walking around saying, Well, I can hear, so I must hear fine.
Yes, but the ability to hear like different like noise, different type of like background noises, different. So, and the thing is, our ear originally is so perfect. We able to hear like it's a huge range of different type of frequency, and unfortunately, we're losing it with the time. And you mentioned like amazing things. So the hardest part is for me, which is absolutely interesting and fascinating, that you already mentioned, the connection between like the brain. So the audiology path is very important, like in multiple ways for our cognitive, for our overall physical wellness, because audiology path is like a big part of our brain, and it's basically touches like multiple aspects. So the thing is, how we can, is there any like test or whatever evaluation tool that would help us to, I mean, in terms of, you already mentioned briefly, but I would like to like discuss it more precisely. So,
So we're,
like connection to the brain. Yes.
In our, look, let me, allow me, I promise 40 seconds, no more. Allow me to tell you a little story about hearing loss and cognition and cognitive decline. It was back in the 80s. It was 39 years ago that the first paper came out that said people with moderate or worse hearing loss are at a higher risk of cognitive decline and dementia. It was a simple observational study. I don't know why. I was 10 years old at the time, so it wasn't me, but I don't know why, but the article seemed to be ignored. Fast forward in 2011, Johns Hopkins put out this huge report about hearing loss and incident dementia. And what it claimed was that hearing loss as you get older can increase your risk of cognitive decline by 200 to 500%. I mean, this was big news. It was all over the TV. It was in the newspaper, all the scientific reports. Now, it faded a little bit, but since then, it's hard to even count the number of studies that have replicated that work. And what is most fascinating and exciting to me, fast forward now to 2025, in just the last 5 years, there have been multiple international studies finding that treating hearing loss may slow the progression or possibly prevent cognitive decline and dementia. So that's what the last 30, 40 years has looked like. Now, to your question, now that we know this, I believe it's our responsibility, again, to do more than just beeps. And so we have a full cognitive screening in our practice. We look at visual memory, executive function, processing speed, reaction time, memory. So these are things that we know hearing loss impacts these cognitive domains. So we have to test them.
And I know there is a strong correlation hearing with several like multiple mental health conditions. For example, autism. People with autism have really serious issues with hearing. And plus there is multiple, I mean, we know statistically that those people are at highest, like there is the chance they will get dementia later in their life. It's like 100%.
There was an article that came out in late 2024 that found a correlation with hearing loss and Parkinson's disease. If you understand, if you're a student of the neurologic system, this is not surprising, because hearing loss, Parkinson's, cognitive decline, emotional disorders like depression, schizophrenia, these are neurologic disorders. And so one neurologic disorder does increase the risk of another neurologic disorder. It's very simple. It's very black and white to a neurologist, to a neuroscientist like myself who studied the brain for years, that these things can go hand in hand. And so, yes, oftentimes you see these comorbid neurologic conditions in people with hearing loss.
Well, that just puts audiology on a new stage. Audiology like extremely important in our life. Okay, let's talk more about prevention and wellness, how we can improve the situation, how we can, first of all, how can we protect ourselves? Let's talk about safety. Safety first, because I'm like, I'm a big fan of safety. I'm producing myself a safety product. So let's talk about safety. How we can, on the first stage, how can we protect? I know that hearing loss associated with the aging. It's very hard.
Yeah.
But what can we do to protect ourselves from hearing loss?
So this is a great question. I'm not sure there's much you can do, and I'm trying to convey this message here that there's much you can do to protect yourself from hearing loss. But I think what you're really asking is to protect yourself from the consequences of hearing loss. So here's a perfect thing.
It is to a little bit in terms of like speed of the decline.
Oh yeah, yes. Fair. Well, look, I mean, to me, that's very simple. Every medical condition, the prognosis is best if you catch it early and treat it early. And so the point of talking about your first comprehensive hearing test at 50 years old is to catch it early and to treat it early. The average person waits about 10 years before they say, I think I have hearing loss, to when they get treatment. That's 10 lost years. And here's the deal. I want to frame this differently. When you think about hearing loss and why should I treat my hearing loss, it's about maintaining independence. It's about being more confident as an older adult. Look, you and I know the number one fear for older adults is losing their independence. Well, here's the deal. Treating hearing loss may slow or prevent cognitive decline. We know cognitive decline leads to, a loss of independence. How about physical health? We know that hearing loss is linked to an increased risk of a traumatic fall. Falls are the number one injury-related killer in older adults. And so we know that treating hearing loss reduces that risk of a traumatic fall. Social isolation, depression, anxiety, we know these come with hearing loss. And then the flip side of the coin is early treatment of hearing loss improves emotional health, reduces the risk of long-term depression in older adults. So the benefits are far-reaching. And here's my favorite part. There's no side effects with treating hearing loss, right? All you got to do is turn on the TV. If you hear about a new drug, they list 75 side effects, including death. Well, guess what? Treating hearing loss, there's no side effects.
So funny that you mentioned that. That's so true. Because all those medications that they just test for very specific narrow effects, and the side effect, and sometimes it's a lot worse than we think. Anyhow, so prevention. So first of all, it's very bad for our ear to hear really loud noises, right?
Yes.
Loud noises. Second, I know that the most sensitive part of our ear is actually the highest notes.
Yes.
The highest note. The one is related to the fluids, because the ear is very complicated. There are different parts of the ear that are responsible for different type of vibration, different type of sound. So the most.
Let me tell you this analogy, because I think you'll remember this, and I think the audience will appreciate this. When sound enters the ear, it always enters, we'll call it a hallway. It enters the hallway in the higher pitch part of the ear. Now, why do I say that? If the hallway is rugged, where is the rug the most beaten up and the most trampled on? It's right at the doorway. It's right at the entrance. And so sound enters and is constantly beating up and wearing away at the higher pitch parts of the ear. That's why it goes first. It's a very simple analogy. And then as time goes on, with more and more exposure, like I said, throw in some pain meds, some diabetes, some heart issues, it just continues to compound and travel further down the hallway and damage all parts of the ear.
So to prevent, first of all, staying away from loud noise, extend away from high frequency vibrations. Don't stay. I realized recently that staying for a long time in the transportation, like airplanes, cars, it's because they have a lot of vibration, and your basically brain experiences a very high explosion to these high frequency vibrations and impact your brain. So you stay away from as possible. Plus, if you know that some places has really high exposure to the noise, it's better to have some protection for ears. We know that there is multiple way to protect, right?
And it's not. You can go buy a fancy $200 pair of hearing protection, but you can also go to the corner pharmacy store, for $1 and buy foam earplugs, right? I promise you, if you leave a concert and your ears are ringing, we call it the hearing hangover. That is permanent damage that cannot be recovered. You are significantly damaging the neural connections from ear to brain. So it doesn't cost a lot to prevent.
You're getting closer to the dementia if you're experiencing this, right? So in terms of like music, I know that you mentioned multiple times like music, different type of concert. I know that let's talk about the quality of the music we're hearing is very important also, right? So the exposure to, as you said, like visiting like concert, especially like modern music, it actually can impact the way you operate, right? So it has a very bad consequences on us, right? So it's very good. It's better. First of all, it's better to hear if we're listening to music to listen it on a little bit quieter, right? Yes, and plus I know that more sophisticated, like even classical music, because the type of the vibrations, the way how music set up, composed is much healthier for our brain than, for example, exposure to the modern music that actually pushes a lot of tries to play around with your emotional sensations, but actually basically brings you closer to the dementia and mental health situation, mental health disease. Anyhow, so prevention. So we mentioned a lot of things that physically you can do. You can basically prevent somehow hearing loss. So you had like amazing article about like food. I know that even some food, in terms of eating, you basically, if you will, some foods is actually can speedify the process of hearing loss.
Well, look, yeah. So I appreciate you bringing that up because, and by the way, for those who are out there, if you go to excellenceinaudiology.org, all of these articles, I know you've seen some of them online. Anything I post on social media for articles, I also put them there too. This way there's just a bank and it's easy for people to find. But you're 100% right. What you feed your body, you're feeding your brain. And so unhealthy foods can significantly impact the neural integrity of the nervous system, which includes the ears. It's really a very simple thing that you have to eat with your, thinking about how that food's going to impact your mind. And so all the preservatives, all the foods and high fats, these things can really damage not just our GI tract, but our GI tract is directly tied. They say the gut and the brain connection. It's a real thing.
Yes.
And so it's very important to be considerate of your mind when you eat.
You mentioned in one of your articles, you mentioned bananas. The bananas has high level of potassium. And potassium is actually because the first thing people losing in terms of hair loss is like the high pitch. And this high pitch is actually it contains a lot of fluids, and potassium helps to basically keep your body liquids in the balance. So potassium is very important. You mentioned, but I never heard, because when you hear recommendations about like food for brain, they're not talking much about banana. You will not see.
No. And the banana thing, really, it could be bananas. The point is higher potassium. Bananas is like, without the pun, it is literally like the low hanging fruit. It's the easy one that everybody knows has potassium in it. But ultimately, it's more about the potassium than it is the banana, because, and I'm a neuro geek. I studied the inside of the ear for 15 years under microscopes. I mean, I know my way around the inner ear pretty well. And I know that the driver, one of the most important drivers of activity in the ear, is potassium. And so potassium levels can impact the ear. But look, it's also just as simple as, what foods would you eat if you were on a heart healthy diet? Because guess what? The heart is pumping blood and oxygen around the entire body, including the ear. And I think the ear is actually one of the most sensitive organs that if there's any compromise in blood flow, you can lose your hearing, right? And so even just the slowing down of oxygen and blood to the ears can have a dramatic effect on the ears.
You know what? You mentioned such thing as popcorn, salty treats that actually really bad for our hearing.
Here's the thing about my articles about food. I don't think anybody reads them and learns anything, because it's all pretty common sense that there are foods that we shouldn't be eating with lots of preservatives, right? Like, I don't think I've uncovered anything. Yes, we should eat more nuts, more olive oil. The Mediterranean diet is fabulous for the heart, for the gut, and for the brain. The mind diet, it's got the word right in it. The mind diet is fabulous for the brain. What you're doing when you're eating is you are filling your body with the nutrients it needs in order to pump, right? To pump the blood, to keep the nervous system active. Our nervous system relies on nutrients. When nerves fire off, they use energy. It has to be replenished, and it's got to be good energy, not bad energy.
Yes, but when we're talking about very specific thing about hearing, you're mentioning that caffeine, like stimulators like caffeine, is actually bad for hearing.
So and look, I drink coffee, so it can't, what I mean by that is what, like we all, we pretty much all do. When I talk about coffee, I'm not talking about 1 or 2 cups, but here's the deal. When somebody comes in and talks about ringing in their ears, it's one of the very first questions I ask. And I can tell you there is a higher correlation. The person who says I have 4 cups of coffee a day has more tinnitus than people who don't. It's one of those chemical triggers, right? So when you think about the ears, when you think about the ringing, there's physical triggers like noise. There's chemical triggers like food, caffeine, chocolate, tonic water. There's all sorts of things. And then there's also emotional triggers. And so a lot of people with tinnitus will tell you it's a vicious cycle. They get tinnitus, they get sad, they get depressed, the tinnitus gets worse. They get more sad, they get more depressed, more anxious, the tinnitus gets worse. Those two are very highly tied to each other.
Yeah, so talking about tinnitus, you mentioned, I found in your articles that the causes can include even emotional stress. So it can be brain trauma.
Oh yeah.
It can be emotional trauma. And one of the big aspects of the treatment, it's actually therapy. So it's like to healing, emotional healing. So one of the approaches to treat or prevent is actually emotional healing, right? It's very interesting.
Absolutely. I'm just in the process. I think we're going to wrap it up in about the next week or so, but I work with a number of colleagues in the field of psychology, and we're just finishing an article about the real links of emotional stress, anxiety, the emotional disorders, and how closely tied they are to hearing loss and tinnitus. And you're right. It really, look, you use the word cause? Does emotional disorder cause tinnitus? I would say it compounds it. It makes it worse. And we know if you have a history of mental health issues, so if you have a history of anxiety disorder, depression, we know that your experience with tinnitus will be worse than somebody else. So if you and I have the same amount of ringing in our ears, but I have a history of mental health issues, for me, I'm going to say it's worse because my limbic system, because my emotional system is already compromised, if you will.
So let's talk a little bit about the treatment and how we can stimulate or improve the situation. So we already know that there's a high connection to multiple levels of the brain, it impacts our mental self, cognitive system, etc. Is there any way there's some specific cognitive exercise, or maybe it's what is the best way to approach? Can we do some exercise to prevent, as a wellness tool, to maybe listening different type of whatever sounds, maybe doing
yeah, I think I get your question. Look, if we're talking especially about tinnitus, hearing loss, the most important thing you can do, and you have to think about it in very simple terms. As you get older, your brain gets deprived of sound, and that impacts your memory, it impacts your emotional health. So the way to combat, and it leads to ringing in the ears, the way to combat that is to restore the sound stimulation. And the most proven way to do that is with prescription hearing technology, because what's causing the tinnitus is the lack of stimulation from the ear to the brain. And so if you restore that stimulation, same with the memory issues, with hearing issues, hearing in background, if you can restore, if you can activate the nerves that are hanging on and keep them strong and vibrant, not only will it slow the progression of the hearing loss and the tinnitus, but it will, for many people, about 90% of patients, they'll say their tinnitus is silenced. Maybe they hear it a little bit, but it's significantly reduced. For some, they say it's gone. So it's about restoring the missing input to the brain.
That's impressive. So basically, the hearing aids are they're very important, and it's better to use them.
Oh, yeah, yes. Maybe we need to move that to the beginning of this episode, but that is the single most important thing you can do, because what we now know, and we could talk about two different things here. One, multiple international studies have said hearing aids use is significantly correlated with a reduced risk of cognitive decline and dementia. And then talking about tinnitus, even the American Academy of Otolaryngology, which is all the ENTs, will tell you the most effective treatment for tinnitus is prescription hearing aids. So yes, that's why I say catch it early and treat it early. It's probably, in my opinion, one of the most important things you can do for healthy aging, because of those consequences we talked about, like social health, physical health, and so on.
That's absolutely amazing. Let's talk about finding a right specialist, because I know that that's important. And I know that you created your company for that reason, because it's very important to find for prevention. It's very important to find the right person. It's very important to find the right hearing aids on the early stages. So tell us a little bit, what is the best way to find specialists, and what is the best way to do it?
So look, what we've done is we have put together an international group of trained and vetted hearing healthcare professionals. So whether if you're in the US, whether you're in the Australia, I think there's UK, there's South Africa, there's Canada. This is a global network of trained and vetted hearing healthcare professionals, and they can easily be found at excellenceinaudiology.org. It's just, one long word, excellenceinaudiology.org. Once you're there, if you want to read those articles, you can click the buttons to get you to the resources. If you want to find a local trained and vetted hearing specialist, you just hit I think it says find your local provider. It is filled with information. I think there's even links that'll get you a free copy of my Amazon.com best-selling book, Preventing Decline, all about the medical treatment of hearing loss and tinnitus, right? I'm giving away this information because right now there's 1.5 billion people on this planet with hearing loss. That number is expected to jump to 2.5 billion in the next 20 years. We have to do something to get the word out there.
Absolutely. So thank you so much for mentioning this. And in terms of medication, in terms of treatment, can you mention what is the common way of treatment nowadays? How people get treated? It's not just about hearing aids, right? There is a more.
No, it's an entire comprehensive process, right? So I people come in, and I love that you said that, because even people come in and they're like, so am I just buying a hearing aid? Look, you can just buy a hearing aid anywhere, in an electronic store, a big box store. You can buy it on the internet. I mean, they're everywhere. Daytime TV sells them, radio sells them. They are everywhere. The vast majority of those are either traditional hearing aids or over the counter, what I like to call DIY hearing aids. It's like trying to treat yourself. It's like trying to do a colonoscopy on yourself. It can't be done. And there's no evidence that this at-home do-it-yourself option for hearing aids works. Part of the process with prescription hearing aids is not only the diagnostic evaluation, there's pre and post metrics. There's what we call, it's a fancy word, REALIA verification. So we actually verify that your brain is getting the stimulation that you require in order to hear better and reduce your tinnitus. There's so much that goes into treating hearing loss. I often say the hearing aid is about 10% of the treatment process. And then we work with many partners for our patients to go on to get cognitive rehabilitation, be it through preventingdecline.com, Brain HQ. I mean, there's so much to helping our patients. Hearing is just the start of it.
Yes, and you know what, we have to mention that there is a direct connection of physical, because you mentioned that we know that with the hearing loss, people lose the feel of sense of balance. People, there's a high chance to fall down, and the thing is the physical, the muscles losing their strength, and there is a brain starts to lose connection with the muscles and the overall body, other organs too. So hearing strongly connected pretty much within every single part of our brain. It's very it's strongly connected to our physical wellness, to health, to our emotional, mental health. So it's extremely, extremely important to take care of it as early as possible. And we know for sure that we're all losing, because it's absolutely avoidable, because it's a part of the aging process. We have to take care of it, because there's a strong connection with the cognitive decline and other issues with the brain.
Look, modern medicine has helped us double the lifespan in the last 120 years. The question is, how are you going to live those extra 40 years? How are you going to make the most of those years? Yeah. Because if you're in a hospital bed, if you're institutionalized, if you're separated from family and friends, then what's it for? What's the point, right? So Absolutely. Make the most of those last few years and do everything you can to prevent decline.
Yes. So you're very welcome. Everyone who's listening, please visit Dr. Keith Darrow website, the excellence in audiology.org, right?
Yes.
So yes, you have to visit it and watch, because it's extremely important. Also, we encourage every single of you to visit a specialist and take care of your ears, because that's extremely important. Dr. Keith, thank you so much for your time. It was very interesting and impressive. Thank you.
Thank you for having me.